Record. Okay. All right. So good. It's recording. So as I say, I will go ahead and make sure this gets downloaded. Did you all get some rest? What?
A little bit.
All right.
I guarantee I will.
All right, guys. So bear in mind, there's 50 questions. 50 questions. You have 100 minutes, okay? So 2 minutes per question. 50 questions, 100 minutes. About 5 of the questions are going to be dosage count, all right? Only 5. I know some people would prefer that, right? So let's just talk about this a minute. For instance, the things I want you to know. Patient teaching regarding Parkinson's disease. Know about gabapentin. And we're going to talk about gabapentin, because GABA isn't just used for seizures. It can also be used for pain management like peripheral neuropathy. So if somebody's on GABA and they don't have seizures, think about what else it's used for. There's a medication I'm going to talk about this afternoon called entacapone. It's a medication that is used in Parkinson's, I think it's Parkinson's. It causes dark urine, but it's not a problem. But you do have to monitor liver function and kidney function with this particular med. Entacapone. It's on that list of meds that I showed you yesterday.
You said monitor liver and kidney?
Yeah. Remember, I don't need to repeat this. I'm recording it. I'm recording it, okay? I'm recording it for a reason, so I can bam, 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 and you can then go to the recording, all right? Okay, patient teaching about benzodiazepines. Benzodiazepines, things that end in a what? What does it end in? AM, amprazolam. Remember? Pam. Lorazepam, alprazolam. Those are your endings. That's your clue for benzodiazepines. Okay. Things like first pass effect. Remember I talked about first pass effect. Remember way back last week? I know that's a long time ago, right? Succinylcholine. We talked about that yesterday. Remember what it's used for? Remember what that is used for? It works immediately. What's it used for? Anybody?
Paralytic? For anesthesia?
Yes, for intubation, right? Yeah. If you need to intubate, that's what they're going to use for quick intubation. So what do you need to have close by really quickly?
A ventilator.
Good. You better. I mean, you know, I hope. All right. Opioids or any medicine. Remember when I said oral meds, there's a fast and slow. Remember that little grid that you need to know what works the quickest and what works the slowest.
As far as the forms, right?
Oral medication, not parental. That's always going to work quicker than oral anyway. All right, but what would be the slowest relief? Yeah. All right, anesthesia. Remember yesterday, one of the side effects that I said comes up a lot? Yeah, any people? Well, that's for regional. But I'm talking about general anesthesia. Remember I said that there is a side effect that comes up that we don't really tend to see a lot. Remember malignant hyperthermia?
Oh, yeah.
Remember that one? I said you need to know it.
hypo.
Hyper.
We talked about it today.
Oh, there you go.
Yes.
Hyper.
Hyper.
Hyper. Hyper. What's hyper?
High.
High. Hypo. Low. Right? Use your voice. Hyper. Hypo. You can tell I have amongst my many degrees, one of them was music and drama. Yeah. All right. Endoscopies. Remember, we can use certain medications, but the patient is conscious, right? But they're not going to remember it. Remember that medication? We talked about that.
That's the one they give you having the C-section.
Versed or what? What's the other one that Michael Jackson overdosed on? Thank you. That type of medication, but it's conscious sedation. All right, so know that. They're doing well, right? They listened. It's awesome. Half-life. Remember that term, half-life. What does that mean? Anyone remember what I mean by that? Half of it. Yeah. Pretty straightforward. So you suppose it's an 8-hour half-life, right? 8 hours, it's going to be half the amount that it started out at. Gosh, you guys are good. All right. Think about remember I said about your elderly and your young people. Drug toxicity is more of an issue for them, isn't it? Yeah. Children, of course, because their kidneys and livers are not as mature. And older people, because people like us, as we're getting older, ours are sort of fading out a little bit. Yes.
It said that
Let me finish this but yes, that is the type of question. I know exactly which one you're talking about. It was liver. For children? You're talking about the children?
Yeah.
And I'll tell you why I brought that up about that. Remember, when we talk about excretion,
That's the one that's
excretion or what was the other term?
It was pretty much the liver or the pancreas or the
We'll talk about that afterwards, but let me go through this because remember I said for you guys to know the difference between excretion and absorption, or meaning metabolism. Two different terms. And it depends on what we're talking about, depends on whether it's kidney or liver. Remember? What do we do with the liver? We metabolize because of the P450 enzyme system, right? Yeah? So anyway, I'm sidetracking. All right. Know about some of your terms, ethical terms. What term means to tell the truth? Anybody remember?
Veracity.
Veracity. Good job.
Veracity.
Know about your 9 rights. To do with what? What's that to do with?
Medicine.
Thank you.
Right time, right drug, right dose, right documentation.
Yeah. Make sure that you understand that you could be liable, even though, a doctor might write an order for something, but it's your responsibility, my responsibility to know about that med. And if you don't know about that med, I'm constantly looking up things every day. I'm still looking up meds all the time. When I'm writing an order for something, I'm always looking, always checking. I don't just take it for granted that because I've been a nurse for a long time that I know what I'm talking about. In fact, the more I'm in nursing, the more I realize I don't know what I'm talking about. Okay? Yes. Hold that thought. Let me spin that through these. All right. So look up, make sure you're checking reactions to things. Medication errors, understand that. Tylenol. What's the other word for Tylenol? Thank you. Or from where I come from, paracetamol. But anyway, paracetamol. I know. Anyway, so acetaminophen, make sure you understand what it's toxic to what.
The liver.
Yeah, toxicity, right? So understand the dosing of that as well, please. What's the other word for the liver?
I'm not gonna lie, I don't know.
Hepatic.
What is it?
Hepatic.
So if you see the word hepatic in some way, you need to know what that means, right? Otherwise you get that wrong. Okay. Opioid overdoses. We talked about this, didn't we? What do you think the patient's going to look like with an opioid overdose? You just did vital signs. What vital sign might be?
Respiration.
Thank you. Respirations. They'd be lower than what? What are you looking at? A respiration lower than
12.
12, yeah. 12, is anything like, that's not good, right? So that's what you're looking at, that's type of thing. All right. Again, know your respirations. What med are you going to give to reverse as an antidote? What is it? What medication is an antidote for an opioid?
Narcan.
Naloxone, right? All right. What medication might be given if you're trying to calm somebody down? We talked about this yesterday. Yeah. What? Yes. What's the other word for it though? What's the generic name?
Advenic? I don't remember.
No, that's not that. Alprazolam, right? Anything with the pam on the end, lorazepam, diazepam, alprazolam. These are your benzodiazepines. These are your calming people down meds. For a minute, anyway. I need to just give you all one, right? Told you, go get some GABA. All right. Insomnia. Now, I'm going to tell you about this med because I sort of skimmed over it a little bit. I mentioned a medication called Lunesta yesterday. Lunesta it doesn't work the same as some of the other meds. It's a non-benzodiazepine, so it doesn't have quite the things like Ambien has. It doesn't have those types of issues, but it is for insomnia, and it is more for long-term insomnia. So I'm sort of just going to give you that because I didn't really talk about it. I sort of mentioned it, but I didn't really tell you about it. All right. Methylphenidate. What is it? Methylphenidate. Remember I mentioned to you guys that we don't see it a lot in England, but we see it a lot here.
Is it for the weight loss?
No. Well, these are your amphetamines, right? This is your amphetamines. Yeah. Ritalin. Are you going to give it to your child at 6 p.m. at night?
No.
I hope not. Unless you're a night owl. Okay. When would you give it?
It's like 6 hours before you go to sleep, right? Well, that's a different medicine.
I would not give anybody. That's a different med. It speeds you up, right? These are all the meds that are your whatever the word is. I don't know the word off the top of my head. But these are the medicines that are they basically work like speed, right? That's what they do. So, all right. Let's look at a couple more.
When's the best time to give it?
Morning, really. I mean, some of them are dosed twice a day. Yeah, I got you. I would say, morning or lunchtime, but I certainly wouldn't be giving it later in the day, and certainly wouldn't be giving it in the evening thinking, well, I'll give it in the evening, it will start working by morning. That's not going to help at all. Remember, if you're giving this to children, what are we going to make sure? They're growing, right? We want to check their growth, height and weight, those types of things. Hope I'm not too far away from this. Well, let's move on from that. So somebody who's having orlistat, which is in the same genre, but we use it for weight loss. The point is that that medication is for weight loss, right? So we want to make sure that if somebody is obese and we're giving it, that we want to make sure it's doing what it's supposed to be doing for them. So not all is the answer. Okay. Kava, remember I said there's always going to be these herb things stuck in there, all right? Kava helps calm people down. That's great, but not if they're taking something like a benzodiazepine. There could be contraindications and risks, yeah? Excuse me. All right. All right, now we haven't talked about these meds. I'm going to talk about this afternoon, but Dilantin is a medication that, who did the anti-epileptic stuff yesterday? You guys, right? So, we use this medication, phenytoin, right? We use this for seizures. And there's a lot to it that we'll talk about, but I do want you to be aware of that and the side effects of this particular med, of which there are a lot. It's sort of, phenytoin, Dilantin is one of those meds that has a narrow therapeutic index, right? You learned about this, didn't you? So what does that mean? Anybody know what that means? Like people that did?
It doesn't take much to make it toxic or from therapeutic to toxic.
Good job. So that's what we're looking at. So some of these meds, you have to do blood levels because we got to make sure it's not getting toxic, and we want to make sure that it's therapeutic. If somebody is on phenytoin, we want to make sure that it's therapeutic so that what?
It's working.
It's working so that what?
You're not having seizures.
There you go. Exactly. Right. Let's see. How am I doing? Okay. Parkinson meds. Parkinson meds, what happens is sometimes it can take a couple of months for these meds to really get on board, okay? They're not going to work really quickly. So if the patient is on one of these meds and they're like, hey, I've been on this a month and I'm not really noticing any difference, I'm going to stop it. There's some patient teaching that needs to go on there, right? That they need to continue this. Carbidopa-levodopa, which is the main sort of cornerstone med for Parkinson's that we're going to talk about. I want you to know the adverse effects. Adverse effects of that. Carbidopa-levodopa. And also understand why there's two drugs involved. Basically, you would have to give a lot of levodopa for it to be effective in the body. So carbidopa is the car that helps give levodopa to the body. That's how I sort of explain it. And I think it talks about that in your book too. Because it wouldn't be able to metabolize. So you would just need so much of it. All right, let me look. I want you to know some lab results. No CBC, have you started looking at that in funds? A CBC level?
Yeah.
I want you to know your chemistry panel. So what is a normal potassium?
3.5 to 5.
Okay, so is 6 too high?
Yes.
Right. So I want you to know your levels of sodium and your potassium, those types of levels, please. Okay. Blood pressure. You've been checking that today. What is a normal blood pressure? What is a normal heart rate? Roughly. Yeah. So is 150 too high?
Yes.
I would think so. Okay. What are you going to do about it? You're going to let someone know? Maybe call the doctor, right? Okay. Migraines. Remember I talked about migraines? And I know some of you have them. So what's the medication that's known as the abortive med? It's not a preventative med, meaning it's the medication that you take when you feel that a migraine is coming on. Generally speaking. No, don't talk about your own. This is very important to know. When we start thinking about our own experiences rather than going by the book, that's when we risk getting the question wrong. I've been guilty of that many times. Triptans, all right? Think triptans. That's really the main one. And remember triptans and the ergo-alkaloid, they cannot be used together, right? The ergo, can't remember the name, but the, I'll get it for you. Yes, they cannot be used together. Create too many side effects. Things like hypotension, I think. All right, Dilaudid. But triptans are what you want to know. Let's see, what else have I got here? I've only got 10 minutes with you. Know the side effects of Dilaudid. And we haven't talked about epilepsy yet. We will this afternoon. But remember I said that barbiturates we don't use those so much anymore. Really the only time we tend to use them are for epilepsy. More for epilepsy than anything else because of the side effects of them. So we tend to use barbiturates more for epilepsy. Okay? And okay, let's see. Know a little bit about over-the-counter medications in your elderly. And then I've got some Selectol that apply ones. The stimulants, that's the word I was looking for. I can't remember the word. Know a little bit about stimulants. What are they for? Right? We talked about that yesterday, and we've mentioned a few of them today. What are stimulants for?
To give you energy. They're used to.
Well, we talked.
Right?
Well, ADHD, weight loss, a couple of them, right? Narcolepsy. Remember the one about neonates and apnea, which means they're having difficulty breathing? Remember I said there's a form of caffeine that gets used for this respiratory syndrome in neonates? So they get used for a lot of different things. So remember, this is Selectol that apply. And when we talk this afternoon about epilepsy, one of the terms that you may see is AED, and that just basically means anti-epileptic drugs, all right? And again, Selectol that apply regarding the types of drugs and what they're for. Okay, and then your dosage calc, I don't even think I've given you, no, I haven't even given you a mils per hour one. It's just know your teaspoons versus mils. Remember I did the formula for you where order over have multiplied by volume, or desired over have multiplied by volume, so that you can calculate medications. Some people do it in their head, but you know, there's a nice little formula for you. Um,
Bring calculators if you give us calculators.
I will give you calculators. Yep. And know the difference between your micrograms and milligrams. Okay? How many micrograms in a milligram?
1,000.
Thank you. All right. That is that. So let me turn this off. So